And I just wanted to thank both Paul and Werner for your wonderful leadership. I want to thank CFAR for the ongoing mentorship and support. And I think particularly the openness and inclusion of folks at SFDPH within CFAR and within UCSF. I think it's been great to have that collaboration and partnership. So I'm going to share some of the work that we're doing with digital strategies to support PrEP implementation and HIV testing within the health department. And just as background, a lot of our work is being done with young men who have sex with men who are particularly vulnerable to HIV within the U.S. These are data from CDC showing annual numbers of HIV infections among gay and bisexual men. And you can see that folks who are under the age of 35 have the highest number of infections within the U.S., and those between 25 and 34 are actually seeing increasing numbers of infections, which is concerning. And particularly young Black and Latino men who have sex with men are particularly vulnerable to HIV. About a quarter of new infections among MSM are happening in young men who have sex with men, and over 3/4 of infections among young men who have sex with men are occurring in Black and Latino men. So HIV testing is really a critical component of the status neutral continuum. And the idea of this is that people who test HIV positive enter the HIV treatment continuum, which is shown in the right. And those who test negative now have a number of prevention options, including PrEP, and the prevention continuum, which is shown on the left. And it's important to highlight that a number of social determinants and structural factors impact the ability of individuals to undergo HIV testing as well as enter the continuum. These include things like racism, homophobia, and stigma. So now focusing on the prevention continuum within young men who have sex with men, we can see that there are a number of gaps at each of the steps of the cascade. And first of all, we see that youth have lower rates of HIV testing. Among approximately half of youth have not tested within the last year. And the largest proportion, the youth account for the largest proportion of men who have sex with men with undiagnosed HIV infections. We also see that underestimation of HIV risk is actually quite common, and particularly among youth. And in part because of stigma that providers can actually have, many folks don't feel comfortable disclosing their sexual behaviors to their healthcare providers. We see across a number of studies that there's lower awareness and uptake of PrEP among young men who have sex with men. And in fact, only 11% of men who initiated PrEP were under the age of 25. And finally, we also see that there's lower PrEP adherence and retention in care among youth. And in two PrEP demonstration projects, less than a third of the youth were able to maintain protective levels of PrEP with less frequent visits. So clearly we need strategies to better support youth across the prevention continuum. So mobile phone strategies and technologies have enormous potential to reach and engage youth in HIV prevention. We know that cell phones are ubiquitous, and particularly in youth, you can see highlighted in yellow that almost all own a smartphone in the US. Also, we know that youth, Black and Latinx folks are more likely to download apps to their phones and use them to access the internet. And technology interventions are scalable and have the potential for broad dissemination. So technology can be leveraged to support the HIV testing and PrEP continuum. And today I'm going to talk about 4 projects that we've been developing and testing, which intervene at various steps of the cascade. And this includes a project called LINKS, which is really focused on increasing testing and PrEP uptake. 2 projects called PrEPmate and .diary, which are focused later in the continuum, focused on retaining people in PrEP care, as well as adherence. And then I'm going to talk about a study called Quickie, where we're actually trying to monitor how well we're doing with implementing various strategies to improve the PrEP cascade. So the first intervention is called LINKS. This is a project, a collaboration with Dr. Hyman Scott, who's also at the Department of Health, and it's through the Adolescent Trials Network, one of the NIH-funded networks. And this is a project to develop a novel mobile app to increase HIV testing and PrEP uptake among young men of sex with men between the ages of 15 and 24. We're using a theoretical model called the IMB, or Information Motivation Behavioral Skills model for the intervention, and so a number of components are addressing strategies to increase uptake of testing and PrEP. And this is a design that we're using. It's a three-part study where we're starting with some formative work, qualitative work with youth. Then we're doing a technical pilot to work out some of the glitches with the technology, and then testing it in a pilot randomized clinical trial with 60 young men of sex with men in Chicago and Tampa. And so this shows some of the key features of the app. On the left, you can see that to help people understand their risk for HIV, we've developed a tool called SexPro, which is a short quiz that people take, and it gives them a score from 1 to 20 on how well they're protecting their sexual health. And it was important to have a positive frame so that a higher number means that people are better at protecting their health. It also shows people their score on and off PrEP, so they can see how PrEP can factor into that. In the middle panel, there's a sexual diary built into this so people can track their sexual partners and encounters. And people really wanted feedback on what they were entering in, so we created some data visualizations for people to get insights into their behaviors. And then there's, on the right, you can see there's a feature where people can order home HIV and STI test kits delivered to their doorstep, and then also find clinics where they can get HIV testing as well as PrEP delivery. We also came up with a couple sex-positive badges because people felt like they wanted something more interactive and engaging, and so we incorporated some gamification techniques. And so you can see some of the badges here, and we wanted to be humorous but also reinforce positive behaviors such as getting on PrEP or getting tested for HIV. These are some other badges that we came up with, and interestingly, this was fine. The IRB approved the content, the youth loved the content, but halfway through one of our pilots, we got this message from the App Store saying that our images were sexually explicit, and we had to immediately take them down and come up with other images. So we got together with our team and our designer, and we actually creatively came up with some modifications. And the peach and the eggplant emoji were actually ideas that the youth had come up with within the focus groups, and so we thought we would use those as part of the images. Unfortunately, this was approved through the app, so we'll see how that goes. So in terms of some of the pilot data, we finished a 2-month technical pilot of this app, and most youth used the app, mean of 9 sessions. Most agreed that the app was useful and were satisfied. And importantly, 86% said that they would recommend the app to a friend for testing as well as accessing PrEP. And some of the key features that they liked about the app were the information about PrEP, being able to order kits that would be delivered to them, having instructions about the kits, be able to find a PrEP clinic, the sexual diary, as well as reminders for HIV testing. And one of the components of the app that we added, because people felt like they wanted more interactive communication, was a chat feature where they could write messages to the staff, and we could respond to them within 24 hours. And we actually got a lot of activity within this chat. People had a lot of questions about the test kits, like how do you use this, like what's all this packaging. They were concerned about whether it would have their name on it, and so they really wanted anonymity within the test kits. So we were able to counsel people through that. And then there was this one encounter that, I remember this was New Year's Eve last year, where we got this message at like midnight from this youth who was at a party, and his uncle approached him. He wasn't out to his family except for one person, but somehow his uncle approached him about his sexuality and was kind of confronting him. He felt very uncomfortable in this interaction, and he didn't have anyone to talk to. So he actually wrote this long paragraph about his experience into the app and said, I just need someone to talk to about this. And so through the app, we were able to counsel him and hook him up with some local resources. We also got some interesting questions about penis pumps and how do they work, as well as, importantly, some questions about how do I get tested and how do I get on PrEP. It's not an easy process figuring out which clinic to go to and how to get your PrEP covered, so that's also been a common question. And this is one of the insights from the exit interviews. I think that this app is so beneficial for young gay men who are scared and not confident in talking about this stuff, and they don't have anyone to talk to. I think that's one thing that's really important for this app, because it has the answers, it has where to go, it has everything you need to know when you don't have the answers. So the second strategy I wanted to talk about is called PrEPmate, which is focused, it's actually using SMS, so it's not an app, but it's a text messaging strategy to support PrEP retention and adherence. And it's built off of Rich Lester's work in Africa, using this WellTel model, which was a weekly check-in. How are you doing? And people could respond either I'm doing well or not well. And this simple intervention actually improved both antiretroviral adherence and viral suppression. So we adapted this strategy to support youth taking PrEP. And so we had a weekly check-in on how's PrEP going or how you're doing with your PrEP. But we also included some really fun facts, daily reminders to take their pills that people could customize to when they wanted to receive them. And we tested this among largely Black and Latino youth in Chicago in one of their new PrEP clinics. And people were randomized 2-to-1 to get either this PrEPmate intervention or standard of care, which was counseling from a health educator. And what we found, you can see in green is PrEPmate, the PrEPmate arm, and red is the standard of care. You can see across visits, this is a 36-week study, that at each visit, the visit retention and care was higher in the PrEPmate arm compared with the standard of care arm. And overall, 86% of visits were retained in the PrEPmate arm compared with 71% in the standard of care, with an overall odds ratio of 2.62. We also looked at adherence, measured objectively using tenofovir diphosphate levels within dry blood spots. We also saw improvements in adherence across visits. 72% of visits had protective tenofovir diphosphate levels in the PrEPmate arm compared with 57% in the standard of care arm. And importantly, the efficacy did not differ by age. This was a group of 18 to 29-year-olds, race, ethnicity, education, or health insurance. And we did a number of measures of acceptability of PrEPmate, and both measured early on as well as later in the study, and we found high levels of acceptability. There were a few people who were worried about confidentiality or having problems sending and receiving messages. And importantly, we did not see social harms related to use of PrEPmate. And here's a quote from one of the participants. The sense of having a somewhat total stranger watching out for another person was great to have. Jen, who was the study coordinator, was that total stranger to me. And her and I developed a pseudo-friendship through PrEPmate. Her weekly check-ins gave me a sense of community and camaraderie that can sometimes be lost in this day and age. So moving on to the third intervention, which is called Dot Diary. And this has been an interesting project. This is a collaboration with Susan Buckbinder, also at the Department of Health, and this company in New York called AI Cure that has developed this artificial intelligence platform using the front-facing camera on your phone It has facial recognition. It can recognize pills, and it uses motion sensing technology so it can track when you're swallowing the pill. And it actually can detect cheating behaviors, like if you're spitting out the pills or if you're cheeking the pill. They've come up with all this technology. And they're testing this in different fields, but we were interested in adapting this for PrEP. And this system has a real-time dashboard, so because it's it's recording and transmitting immediately, that the clinic can real-time monitor how well people are doing and then reach out to people if they're having problems. And the feedback we got early on, similar to the Link study, is that people wanted feedback on their data in a useful way. And so what we came up with was these images showing, based on their dosing, recorded by the app, how protected were they from PrEP. And this is based on their dosing in the last 7 days and some PK modeling work by Pete Anderson at the University of Colorado. And so if people had low dosing, then it showed their protection level was low, medium, or high. And it gave them personalized messages on how to get up to high levels of protection. It also gives a summary of their dosing over the last week, which is shown at the top. It also incorporates a sexual diary that we talked about with the Links study. And so you can see that they can enter some of their data here. It also has, you can also rate your partners and different parts of your partner, which they really wanted. But I didn't show that here. And so the way we're visualizing this for people is we're giving a calendar overlay so people can see both the days that they're taking their pill, the days that they're having sex, which is shown in the little star. And so people can see what their sex coverage is like and whether they're missing certain times of day or of the month where they miss their pills. So in terms of preliminary results of this dot diary intervention, we used the system usability scale, which is a common scale used to evaluate different interventions. It's a scale from 0 to 100, and the median SUS scores after 8 weeks of use was 80, which is in the excellent category. Most people thought that the app actually helped with taking PrEP and also were likely to use the app in the future. And the median adherence over the 8 weeks was 91% measured by the app, which is encouraging, but we're currently doing a study to validate that with objective markers with tenofovir diphosphate levels and dry blood spots. So the final intervention, or the final project I wanted to talk about, is a project to monitor how we're doing with the PrEP continuum within the San Francisco Bay Area. And San Francisco, like other large jurisdictions like New York and LA, are seeing really rapid increases in PrEP uptake. In 2017, we think there are about 20,000 individuals are on PrEP within San Francisco. And this is a result of the work of many folks and community-driven efforts, and our San Francisco Getting to Zero efforts. But we really need to monitor how well we're doing with implementation at the various steps of the cascade to see where we're doing well, as well as where the gaps are, who we're missing in terms of implementation. And within San Francisco, both men who have sex with men as well as transgender women are key populations affected by HIV. So we wanted to include both MSM as well as trans women within this assessment. So this is some earlier work that Erin Wilson and I at the health department have been working on to assess the PrEP continuum. And this was done in two population-based cohorts of MSM and trans women. One is the transnational study, which is a study that she's leading in trans women within the Bay Area. And then the other is the NHBS, or National HIV Behavioral Surveillance, which every 3 years monitors a different population. And so what you're seeing here is comparing MSM in yellow with trans women in the teal-green color. And what you can see that at each step of the cascade, PrEP awareness, talking with the provider, PrEP use, as well as being retained on PrEP and adherent, you can see that there's lower there's discrepancies and disparities between trans women and men who have sex with men. We also saw that there were significant differences in social determinants between the populations, and particularly compared with MSM, trans women had lower education, lower income, lower employment, as well as more homelessness. But despite those disparities, we actually see more engagement with providers in trans women and higher levels of health insurance, which is interesting, and it may be because there are a number of clinics providing gender-affirming care and hormones and access to surgery, and that folks are actually engaging in these services. And so, based on part of these findings and realizing that we really need to do a better job of reaching out to the trans community, the San Francisco Department of Public Health launched a campaign, PrEP campaign called PrEP Supports, which folks may have seen locally. And this is really prioritizing reaching out to both cis and trans women of color in our community. Another project that we launched with funding from the California HIV Research Program, this was also a collaboration with Aaron Wilson, it was a project to launch a demonstration project which is really focused on transgender people. It's just called the STAY Study, and the goal was to increase awareness and access to PrEP within the trans community in the Bay Area. And it's really focusing on the resilience and diversity of the community. And so far we have about 160 folks enrolled in the study. So we wanted to see if these interventions that are being tested to increase the access and awareness of PrEP within MSM and trans women, whether these were actually having any impact. We wanted to have a mechanism to do that. And the challenge with the previous strategies was that NHBS is only happening every 3 years, and transnational was sort of a one-time study. And so there wasn't really a way to get a rapid assessment of how we're doing. So we had this idea to use sort of a short mobile web survey that could be sent out, blasted out quickly, and to try to assess this like every quarter or every 6 months so that we can really track what the trends are happening within San Francisco. So this was funded through an NIH supplement to the CDC Project Pride PrEP implementation project, and it's called Quickie. And so the idea is that people can easily sign up and take a short lesson, 5 to 10 minute short quiz, and then we'll check in with them every few months. And what we found was that even just after 2 years since the original assessments, that we see some differences in the cascade now. So here MSMs are shown in blue and trans women are shown in red. And you can see now that PrEP awareness and PrEP initiations really are now similar between MSM and trans women. But where we're still seeing disparities happening are those who are remaining on PrEP, as well as reporting high adherence. So what this work suggests is that we really need to, it's great that we're getting more folks on PrEP, but a challenge is really keeping people on PrEP over time and helping them with adherence. And we wanted to look a little bit more deeply at these PrEP discontinuations, and we actually saw the median duration of PrEP use was only 5 months. So people are stopping PrEP pretty quickly. We looked at those folks who stopped PrEP, and 80% of them had one or more behavioral indications for PrEP. So these are folks who could still benefit from it. And we've actually seen a number of seroconversions of people who have stopped PrEP for various reasons, which is concerning. When asked why people stop PrEP, the most common reasons actually people don't feel that they're at risk for HIV. Insurance and access issues are very common. Also side effects or concerns about side effects, as well as adherence concerns. So in conclusion, HIV testing rates and PrEP uptake and adherence have been low among youth. And mobile technologies are a promising strategy to reach and engage this population. We're working on a number of different strategies, which we talked about. And these platforms can also be used to rapidly assess how well we're doing, and what we learned from that is really PrEP persistence is key. And so some of the next steps of our work are to plan some implementation science work, and we're working with Janet Myers and Kim Kester at CAPS to see if we can actually start doing a comparative effectiveness study to compare some of these strategies to see whether some of the strategies work better in different populations, and particularly also in the South, which have really a lot of new infections happening and very little resources. So with that, I'd like to thank all the collaborators on the various projects, our funders through the NIMH, as well as the Adolescent Trials Network, as well as our technology developers, and of course our study participants who were wonderful collaborators on these projects. Thank you. Kat?
That was fantastic, as always. Thank you so much. So I just had a question looking ahead to how I just wanted to ask you what you see the research agenda being with regard to mHealth and some new PrEP strategies that are emerging, namely PrEP 211 and long-acting injectable cabotegravir.
Yeah, thank you. I think those are great questions. I think within the mHealth world, at least for prevention, that now that at least through a number of investigators and through the Adolescent Trials Network, there are a lot of different apps that are being tested and strategies that are being tested. And I think one challenge is that technology development is so costly and so time-consuming and so lengthy that technologies are rapidly changing so quickly, and so we've been having some discussions about how to combine strategies into platforms that are more easily adaptable, so we can more rapidly evolve and meet the needs of people. When we presented some of this data at the CDC Prevention Conference, they said, we want this app right now, and we don't want to wait 3 years for you to test it, and 3 years later it's going to be obsolete. So really thinking about how can we be more agile with the development as well as the platforms. I think there's also a move to figuring out the next phase of implementation science and how to test these in real-world settings, and also what the cost of these strategies are in terms of sustainability and being able to continue them in the future and who would pay for them. In terms of 211 PrEP and on-demand dosing, or long-acting PrEP, there's definitely a lot of interest in how we can use mHealth to support those strategies. We did recently apply for R34 to adapt some of these tools to support PrEP 211, which is really taking off within San Francisco. And then I've just attended there's a NIH consultation on long-acting prevention where people talked about that we really need novel delivery strategies for people aren't going to be able to go to the clinic every 2 to 3 months to get their injections or other therapies, and so thinking about pharmacies or mobile vans or other strategies in the community that can get the interventions out to the community.
Al, what do you think about over-the-counter PrEP?
Yeah, that's an interesting concept. I think someone was just mentioning that there was talk about getting PrEP through a dispensing machine or an ATM machine. I think we need to look at all different models of how PrEP can be delivered, at the same time balancing monitoring safety and being able to make sure that people know how to use it. There is work on, we also work with the Microbicide Trials Network, looking at various topical strategies like douches or suppositories, which could be administered or delivered over the counter and don't require a prescription, and those may be other strategies that could be effective.
Thanks. That was very impressive what you've done with the groups you've been looking at. I was wondering if there are any intentions to reach injecting drug users with PrEP.
Yeah, that's definitely been an area where there's been less research, particularly around PrEP, and I think some of the formative work that's been done have, identified a number of social and structural factors that are barriers to PrEP access and use in the community. But I think it's definitely a really important area, and some of the new CDC funding that's coming to health departments is really focused on, homeless populations, people who inject drugs, and marginally housed folks, and how we can best reach them with prevention technologies.
Yeah, thanks, Al. Great presentation, great work. Yes, I think you're aware what we've been studying recently is detecting PrEP and ART and blood donations in the U.S. and South Africa, and we're finding pretty substantial rates of people donating blood who are known infected and on ART. Often they're aviremic, they're suppressed, so our NAT testing as we perform is negative, and they have low-level antibodies because of the waning antibodies if people are treated early. And now we're picking up donors in U.S. cities and younger men who are on PrEP donating blood, and surveys are also showing men on PrEP have indicated recent donations. So this is raising concerns of, are we adequately detecting infections, both through blood screening, but also for your field, the current testing, I believe, is based on serologic monitoring and potentially even rapid tests, and the sensitivity of those tests for detecting infections. So just wondering whether you're satisfied with the current ability to detect infections in people on PrEP or post-PrEP, or whether more studies should be done to understand the need for enhanced detection capacity.
Yeah, thanks. I definitely think there is more research that needs to be done in this area, and particularly the concern around detecting infections is when people are starting PrEP, and if they are acutely infected, they can rapidly develop resistance. And even in our early demonstration projects, we were doing rapid fourth generation as well as HIV RNA testing, that folks were testing negative on rapid and fourth gen and had very, very low RNA, and so we were detected very early in infection, and they ended up some of those individuals developed resistance. So I think we do need more sensitive assays, and also definitely with within the blood bank as well. I think it's very interesting opportunities to test large cohorts of individuals on PrEP. Patricia?
Great talk. Thank you so much. My question was piggybacking on what Dr. Bush just said, is if you could comment on what is currently in place for monitoring PrEP breakthrough infections, which we've seen a few cases.
Yeah. So, well, maybe you'd be better to talk about that. But there are a number of it's important to PrEP breakthroughs are very rare events. True breakthroughs are very rare events, but they do happen. And so, it's important to have in place strategies to be able to both counsel people and get them into care, but also collect specimens quickly so that we can go back and look at both pinpoint when infection may have happened, but also look at drug levels over time to see, were people actually adherent to medication. There are studies that both through that Bob Grant and Patricia and others within our health department as well, that we have protocols for people who may have breakthrough infections that it's important that we collect these samples to better understand them.
So I really enjoyed your talk, but one of the things that might be of concern, I think, is all of this is targeting people in PrEP. What about using these similar type apps to include also STI testing? Because that's also something that kind of go parallel to this PrEP.
Yeah, that's great. I think that's a really important point. And the Links app that I mentioned, it does have both HIV and STI testing as part of it, and so people can order STI kits that they can self-swab themselves and send them in and get results. And we have detected a number of folks with asymptomatic infections. But I think there certainly has been an upsurge of STIs, which started even before PrEP came along, but are continuing to rise. And so, better figuring out how to make sure folks are tested, and then testing new strategies such as doxy post-exposure prophylaxis, which is an idea that people are going to be testing, as well as other strategies. Monica?
Hi, all. That was really great, and I think your work, you didn't even mention that win the 2-on-1, you probably will get a grant to do that with the PrEPmate. But so I wanted to ask about the home STI testing, which I totally agree with Geraldine, that's incredibly important, that there's no current assay for home syphilis testing, right? The dried blood spot method we're trying, but it's not there. So it's just the chlamydia and GC for the home STI kits?
Well, in the one that we're testing, it is just the gonorrhea and chlamydia. I think Aaron Siegler at Emory has developed a kit where they collect blood via a finger stick and a little micropipette tube, and so they're able to test it off of that sample. But there has been, I think, less acceptability around people doing or collecting some of the samples. But yeah, that is important.